Opioids. I mean, it's without a doubt, a popular subject, certainly with the new CDC guidelines that have come out and all of the focus, rightfully so, on safety of opioids. We have really good data, and thankfully the CDC recognized this, that treating cancer pain is different than treating chronic pain. And opioids are relatively safe and certainly effective for a small minority of the population. The problem is there's been such a focus on making pain the fifth vital sign and treating it aggressively that we've kind of blanketed everyone thinking that they'll respond the same way to opioids, and we've seen the downside. Deaths from opioid abuse, overdose, addiction in Pennsylvania now in the past 3 years have outstripped our traffic accident deaths. It's exponentially getting worse. And it's a multifaceted reason why. One is that providers want to help, certainly, so opioids are something in our toolbox to give to patients to make them feel better. The bigger issue is that when we recognize that there are red flags, there's some issues with substance abuse going on, there is such a lack of availability of addiction, abuse treatment, mental health treatment in this country. It's not a Philadelphia problem, it's not a Pennsylvania problem, it's a United States problem. That I often look at these patients and say, here's what we can do, and here's all this other stuff that should be available to you, but given your insurance coverage and what finances you have available to you, I'm not sure that we're reasonably going to be able to get you in for all those services. Not the access to care effort. They help, hopefully, upstream as far as decreasing the initial thought to prescribe opioids, to potentially decrease the rates of development of abuse or addiction, because if less people are getting the medications for causes that might not be necessary, certainly you'll have less problems with addiction down the line, but there's nothing that has really addressed the shortage of that care in this country. In some ways, this is what happens with so many things in the world of medicine, is that the pendulum sort of swings really far to one side because we have new development of medications or technology or something like that, and then the ramifications of that are followed as we sort of jump on the bandwagon and it swings back. I agree. I don't know that I can say for sure that that pendulum isn't going to swing too far to one side, but I think as we're going through this process, it's certainly going to prompt the much needed additional research and give us better guidelines. There aren't guidelines that exist that tell us what is appropriate dosing, what is appropriate time length for non-cancer pain. There's really very few studies that even follow patients for longer than 6 to 12 weeks when they're getting these types of medications. It's certainly not harmful in any way. I think anything we can do along those lines is a good thing. I tell patients the best part about this is there's no bad side effects. There's no downside to it. So absolutely. I'm not sure that it stems ultimately those that are going to go on to develop problems with addiction or abuse. I think we have such an issue with being able to get these medications from non-providers that you're going to get something in some form that you can abuse it. So many of my colleagues and friends are telling me they're feeling the squeeze of see more people, see them faster, do more with the same 24 hours in any given day, driving people out of clinical practice, and the acknowledgement that our population isn't getting smaller, we're getting older, we're getting more chronically ill, we need more patients. Aside from a sort of wholesale reform of how we look at taking care of patients, I think you just go to work one day at a time and say, what can I do today? And try not to feel overwhelmed by the enormity of the bigger problem itself. I don't think in the history of this country we've been able to curb addictive behaviors, abuse. I don't see that this will ever go away. You know, we've struggled with alcohol for however long we've had it. This prohibition didn't fix the problem. We've cycled back. So I don't see it going away. I see that we can forever improve how we service patients that have issues with abuse and addiction, and in that way be able to improve our treatment of it. It should be, and it can be, a really helpful, multifaceted approach to patient suffering. We don't have always a very good understanding of what the etiology of people's pain is. It might not necessarily be something that lights up bright on a PET scan or reveals itself in blood work, but I think we have the opportunity to say, listen, some of pain is directly attributable to a physical cause. Some of pain is emotional. Some of pain is social. How do we appropriately address that and knock down the walls to people feeling like the answer is, I need a pill to fix something? You know, I think the vast majority of times, probably, family medicine, primary care physicians can and do a great job. The problem is time. You need time to do a really good pain assessment, to have a multidisciplinary approach to be able to take care of patients' pain. And that poor internist that's supposed to see patients every 10 to 15 minutes, I don't know how they do that. So it's not that they're not amazingly good doctors and doing a good job. It's just, how do I do this and have the time to see the other 15 patients on my schedule? There is going to continue to always be advances in interventional pain management, things that people can do either surgically or minimally invasively. And I think that's one sort of side of the future of pain medicine. The other side, I think that my hope is with this acknowledgement that it's not just about opioids or pills. We really have to look at the whole person and taking, in some ways, a palliative approach to this. I may never be able to fix this, but let's come to some kind of common ground where we can say, I can help you have some quality of life, and looking at the way to treat people holistically. I think that's the other side of the way that pain medicine has to go.